Welcome back. Welcome back to forpay.org. This is Consumers Dr. Bengala. Thank you for joining us. Today's topic, insurers' obligations. Insurers' obligations. Folks, insurance concept is one of the best things we have ever formulated in healthcare. Don't take me wrong, but insurers have an obligation towards you, consumer. Today I'll talk about what insurance behaviors can be modified and how it will help you and me together. Okay? Number one, insurers are not in the favor of lowering the cost. I want to re-emphasize that insurers are not interested in lowering the cost of the healthcare. If they are serious about it, we wouldn't be spending $3.8 trillion in healthcare. How did we get here? Partly multiple factors, partly to blame the government, the insurance industry, and providers, everybody to be blamed in this. But today my main focus is insurers' obligation to you. Insurers' goal is to collect the premium and make profits off the premium. I have no problem with that. But insurers' obligations are to you how to help a consumer like you to lower the cost of the premium and lower the cost of the care. They can do it. If you lower the cost of the care, the premiums will automatically go down, folks. But they don't do that. Why? I have no idea. I tell you how the insurers, this is something for the insurance to look into it. If a young person in their 30s paying an insurance premium of $200 something is fundamentally wrong, folks. $200, $300, because insurers are not segmenting their risks. Young folks, you're talking about 68% of the Americans are healthy. Most of them, they hardly see a doctor, they hardly go to a hospital, they do just routine checkups, but their premiums are, in general, are too high because there is no segmentation by the category. There has to be a segmentation by, into 4 categories: well category, at-risk category, chronic illness category, and catastrophic. This concept I've laid out from a well-known actuarial, Ron Bachman. He's the one who started this Medicare supplemental, folks. I want you to go to the forpay.org and there is thing called Unlocking the Secrets of Health Insurance. Unlocking the Secrets of Health Insurance. I want you to read that book before I have read that book over and over again. I can tell you, we really need to. Insurers are serious about helping the folks like you and me. They need to start segmenting. We don't need to mandate. Insurers' obligation is to you. But ultimately, it boils down to the representatives in Washington, the government. Do we need a government-based healthcare, or do we need a public-private partnership? Lots of Democrats are in favor of public-private partnership in every venture. Why healthcare is not going in that direction, I can't tell you. I cannot tell you, because these lobbyists are working hard to keep the status quo. So we really need to switch the gears to public-private partnership, where there is no government intervention, there's no one size fits all. It gets modified every level, and focus is on the impaired. The focus is on the impaired. You know how many people really have health related issues we have to tackle? Only 2 to 3% of the population, folks. 2 to 3% of the population. You mean to say the US government can't handle 2 to 3% of the sick people under the government subsidized? I'm not talking about the Obamacare. I'm talking about under the government subsidized through public-private partnership. People are impaired. They really need certificate of guaranteed coverage, folks. Certificate of guaranteed coverage through a public-private partnership. It doesn't cost the government a penny. Yes, it doesn't cost the government a penny. And as a result, the people in well category will have the lowest premiums. And insurers, second obligation is insurers needs to set up a rainy day fund, so-called rainy day fund, for all the so-called consumers. Every member who gets the insurance, they need to facilitate setting up a rainy day fund, so-called health savings account. Rainy day fund, folks, I'm not kidding. It comes in handy. It helps all segments of the population across broad spectrum, low income, middle income, higher income. So by setting up health savings account, so-called rainy day fund, I'm talking about $10 a day, man. $10 a day and $20 for the family. You're talking about $36 a month. $300 a month, $3,600 a year, $600 a month for the family, $7,200 for a year. You mean to say we can't put money aside and insurers cannot help us in setting up those? And they should raise the deductibles. So that way, consumers are ultimately being empowered by the insurers. Insurers' responsibility is to empower the consumer. As a result, it lowers the cost of the care for all. Yes. By empowering the consumer, you will lower the cost, because that you're talking about $36 a year. It goes a long way, folks. In 10 years, it'll be 40 grand. In 20 years, it'll be, you name it, it could go a long way. And you're talking about a family, $72,000, which will be tied to the index funds, and it keeps on appreciating at 10, 15, 20% in the index funds. And it is very safe. And it is yours. And everybody should be having this rainy day fund for healthcare. I would call it a rainy day. When I say health savings, a lot of people don't, they don't have the money. Nobody has the money. I understand that logic. But when you go to, the other day I went to the optometrist for an eye checkup. Simple things, folks, in a Walmart. I said, how much is it? I broke my glasses, and I said, how much it is cost for me to have an eye exam? I said, $60. Fine, I had no problem. But he insisted on me giving insurance. I said, what do you have? You have insurance? I basically said no. You know why? Because once they know you have insurance, they can bill $300, because they know consumers are not interested. As long as you take away the insurance segment of it, they can bill the insurance company $300. He insisted. I said, I don't have any insurance. Even though I had Medicare, I said, no, I pay cash. See, this is the way system works, folks. Any provider, very first thing they want to know if you have insurance. I basically say, no, I don't have insurance. I pay cash. It doesn't matter where you go, hospital, CAT scan, MRI. Folks, insurance is, with insurance, people tend to think, oh, you don't care about the insurance payments. No, I do care about how much is insurance paying. Because I am so pissed off when I stayed in the hospital for an angioplasty for 23 hours. This is what made me think seriously. They sent me a bill. They had the audacity, hospital sent me a bill for $227,000 for 23 hours. I was so pissed. I would say, I need to do something, man. Since I'm retired, let me get to the bottom of what the problem is. This problem is not with you or me, folks. It is the insurers. The insurers' fault. They don't address the cost. They keep making the payments. They think the consumers are stupid. They don't care. They're not interested in how much. That's wrong, folks. We are interested. We want to. That's why consumers have to have a rainy day fund so they can pay initial deductible part. So if consumers have to pay $1,000, they will think really hard before they can spend their money. But when the insurers have to pay, the insurers think consumers don't care what insurance. That's not true. We are interested in how much we get the bill. So every time you go to a hospital or to a surgery center, you name it, hub or radiology, physical therapy, doesn't matter. The prices need to be transparent, and we need to know upfront what the cost is going to be. And you need to pay, not the insurance companies, folks. You need to pay. I don't blame the insurers because I understand they're running a business, but we as consumers need to be empowered. We want total freedom. We need to set up, each one of us, a rainy day fund for healthcare. Rainy day fund, yes, health savings accounts, folks. I can't emphasize the fact which will liberate you in receiving the best healthcare you can get. Guys, keep listening because I'm working on going live. I'm really having issues related to multi-camera streaming with OBS, NDI. So I'll get there. But till then, I'm going to use my own standard way of recording it. So just be patient. Thank you for joining forpay.org. We will see you next time, folks. Goodbye and God bless.